And welcome back to Capitol Tonight. Now, until the state budget is actually passed, it's easy for other bills before the legislature to get lost in the mix a little bit. My next guest is trying to prevent that from happening to a piece of legislation that would give nurse practitioners in New York more leeway to treat patients. Seth Gordon is the president and CEO of the Nurse Practitioner Association. Seth, thanks very much for your time.
Thank you.
I'd like to start, if you wouldn't mind, if you would just give us a definition of what is a nurse practitioner.
Sure. A nurse practitioner is an advanced practice nurse, a registered nurse who receives advanced clinical and academic preparation that enables the individual to treat a wide variety of health problems. Like physicians, they see a wide variety of therapeutic services and are totally, their particular expertise is in primary care, although many are practicing in various specialties.
Okay, so it's somewhere between, they're not doing surgery, for example, but they're also not just taking your pulse either.
Right.
Okay.
They would be doing what you would expect in general medicine, family medicine, general pediatrics, that type of thing.
Okay. So what's the problem specifically for you guys?
Well, the problem is we have a changing healthcare system that's evolving to meet the needs of our patients, and states are typically slow to catch up with the evolution of the healthcare system, and we have an opportunity before us to utilize nurse practitioners to help address some of the pressing problems of our healthcare system, particularly in the areas of access and cost. And one of the major initiatives that we're hoping for is to remove barriers that prevent nurse practitioners from functioning to the full extent of their training and education.
And what would that be specifically?
Our bill, the NP Modernization Act, seeks to remove a statutory requirement for a written collaboration agreement with a physician. That isn't to say that we're trying to remove collaboration. That's a professional responsibility of all healthcare providers. But we're trying to remove the requisite that you have this piece of paper signed by you and a physician as a condition of practice in New York State.
So then, but how would that work then? Would a nurse practitioner be able to set up shop by his or herself?
Well, they already can, actually, but in order to practice, they still need to have a written collaboration agreement with a physician.
So, and this is something that the nurses negotiated actually a long time ago, is that correct?
We did. In 1988, the profession received its title and scope. It was a long, hard battle. It took us 8 years to achieve that, and as a last-minute compromise, we agreed to that in order to provide the public with access to nurse practitioners. I mean, today there's over 150,000 nurse practitioners in the United States, over 16,000 in New York State alone. Can you imagine if we had failed back in 1988 to achieve title and scope?
Well, what you're arguing now is there are people who need to get in to see someone for medical treatment. It doesn't always need to be very complex. It would actually be cheaper from a reimbursement standpoint to be able to see a nurse practitioner. You don't always need to see a doctor when you can see someone who is potentially more accessible and less expensive.
Yeah, absolutely. We have a shortage of primary care physicians in New York State. Some say it's a maldistribution, but it's an access problem. We have 2 million people in this state that reside in medically underserved areas. That translates to about 11% of the state's population. We have areas not just rural, but in urban areas that you don't have access to physicians, primary care, and we're talking about primary care. And of course, with the Affordable Care Act and federal health reform initiatives, by 2014, as you know, we're going to be expanding insurance to the general population and Medicaid in particular.
Right.
And we don't want to repeat the mistakes of Massachusetts, who did something similar but didn't have the providers ready to care for these patients.
Just before we go ahead with who might actually be against this, what kind of treatment specifically, like specific examples that you're talking about that a nurse practitioner can provide?
Well, the nurse practitioners are trained in one of 16 different specialties in New York State, but most practice in family, as family nurse practitioners or as adult nurse practitioners or in pediatrics.
So they could diagnose, they can test, they can write prescriptions?
Absolutely. Diagnose, treat, order lab tests, prescribe, the whole gambit of what you would expect a general physician in primary care.
So this all seems very logical. This is the second year that you guys have been pushing for this, and it hasn't really been going anywhere in Albany. And part of the reason is because the doctors don't agree. Is that correct?
It's generally true. It's made some significant progress. We now have over 25 sponsors in the Assembly, but it's been slow to gain momentum in the Senate. Of course, the majority party's changed in the last few years, so that changes the dynamics. But it's been slow to move, and we're hoping with the discussion of affordable care and what's known to be a problem with primary care shortages and what we know to be ahead of us. We know there's a freight train coming, and unless we produce a primary care infrastructure, and by the way, that's been recently corroborated by the Institute of Medicine, who just released a study in October saying that the future of any successful healthcare reform measure in the United States depends on the future of nursing, and that was authored by a physician.
Yeah, you know, I was under the impression there was a nursing shortage too.
There has been a nursing shortage, but that's been slowly abating. In terms of nurse practitioners, we've actually the trend line for growth has been significant. In the past 5 years, we've seen the number of graduating nurse practitioners increase by over 25%. We graduated about 978 last year and over 1,100 this year. So
what the doctors say basically is you're taking our business.
I think that's true. I think the doctors, it's kind of like their argument on the retail clinics. We shouldn't have retail clinics. If we have retail clinics, the care will suffer. And what they're really saying, and you have to at least empathize a bit, because the reimbursement systems are built around volume. They have to produce high volume as primary care physicians in order to make a living or to sustain their practice. We understand that. However, you don't do that on the backs of the nurse practitioner and at the sacrifice of access for the public.
So this is not directly included in the Medicaid redesign team's proposals for Medicaid reform in this year?
Not directly, but we are pleased that they adopted our proposal for a public health service.
Okay, so I want to thank you very much. This is obviously something going to be coming down the pike rapidly, and I thank you for coming in, Seth Gordon, and perhaps we will be talking to you again soon.
I hope so. Thank you, Liz.